Hi, I'm Dr. David Barbe, President of the American Medical Association. Here are some of the top issues in healthcare. Protecting access to coverage. We have always fought to expand insurance coverage and access to care for our patients, and 2018 will be no different. We're going to work on maintaining the strength of safety net programs like Medicaid and CHIP, preserve patient protections, and stabilize the individual insurance market. Medicare physician payment reform. As Medicare and other insurers are making significant changes in the way physicians are paid, we're advocating for simplification of administrative requirements in payment systems and for payment system changes that do truly improve care. Insurer issues. With increasing concentration in the markets, payers continue to create short-sighted policies that don't consider the overall well-being of patients and create waste in the system. We're creating campaigns to address these bad practices and building broad coalitions to more effectively advocate for improvements. Prior authorization. In a recent survey we conducted, practices reported spending the equivalent of 2 business days per physician per week processing prior authorization requests. This can delay needed treatment for patients and burdens physician practices. We're taking a number of steps this year to combat the overuse and time-consuming process of prior authorization, including working with payers to reduce the overall volume of prior authorizations, increase transparency on requirements, promote automation, and ensure timely care for patients. Regulatory relief. Similar to prior authorization, administrative tasks consume too much time for practices, time that reduces patients' access to care, increases cost, and causes burnout. We're working to eliminate, streamline, and align the many federal rules and regulations imposed on physicians. Ending the opioid epidemic. Physicians have been leading the fight to end the opioid epidemic and will continue this work in 2018 through a comprehensive campaign. We're urging physicians, policymakers, and payers to take action to reverse the epidemic by advocating for increased access to multidisciplinary pain care and treatment for substance use disorders. Drug pricing transparency. The cost of prescription medications increases year after year because the opaque system prioritizes company profits over patient health. This puts treatment out of reach for many patients. Through our truthinrx.org campaign, we are bringing transparency to drug pricing by encouraging patients and physicians to share their stories about how high drug prices have impacted them. Telemedicine. Digital health is changing the way physicians practice medicine and is improving public health. We are modernizing state legislation to lay the groundwork for adoption and expansion of telemedicine and facilitating license portability through support of the Interstate Medical Licensure Compact. Scope of practice. Patient health and well-being are threatened when healthcare practitioners are allowed to practice beyond their education, training, or experience. We're developing innovative advocacy tools to deploy in state legislatures and harnessing the power of organized medicine through our Scope of Practice partnership. What do all these issues have in common? Many of them contribute to physician burnout. It is one of the most critical issues facing our profession right now. Every specialty has shown increasing rates of burnout, early retirement, depression, and sometimes even suicide. So it is critically important that the AMA and each of us as individuals work on these issues to reduce the burden of practice for physicians and improve the joy in practicing medicine.